Welcome to our exploration of one of the most versatile and unique joints in the human body, and that is the shoulder joint. From its remarkable range of motion to its susceptibility to injury, the shoulder joint is a true marvel of anatomical engineering. The shoulder, or the glenohumeral joint, is a ball and socket joint where the long bone of the arm, the humerus, attaches to the shoulder via a very shallow ball and socket joint, the glenohumeral joint. This seemingly simple configuration allows for a vast range of motion. But don't be fooled by its appearance. The shoulder joint's complexity comes from its structure and function. Our shoulder relies on a delicate balance of bones, muscles, tendons, and ligaments. Our rotator cuff plays a crucial role in the stability of the shoulder joint, and the rotator cuff is made up of four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These four muscles keep the humeral head securely in the glenoid joint while allowing a wide range of motion. This joint is capable of a very wide range of motion, in part because of the shallow ball and socket joint. Our shoulders are able to perform flexion, extension, which you can't really see there, abduction, adduction, even horizontal abduction and adduction, as well as circumduction. I was looking a bit at myself because I don't know how much of my arm you can see when I'm doing those movements. It is this very versatility that allows us to do all of the things that we enjoy and the things that we have to do. Consider lifting, throwing, pitching, pulling. There are so many things that the shoulder is responsible for. Consider how often we rely on our shoulders from day to day, whether it's putting things away in the kitchen or carrying in the groceries, opening doors, closing doors, driving, typing. Our shoulders are responsible for so much more than we realize or give them credit for, and it's often not until we're experiencing pain or any limitation in range of motion before we even think to do anything about it. It is the shoulder's very design that makes them so incredibly functional, but also incredibly prone to injuries, either from repetitive use, strain, trauma, bad biomechanics. There are so many ways that our shoulders can be injured, and part of the problem is we don't do anything about it until it's too late. Furthermore, the complexity of the shoulder joint is also part of what makes it so difficult to diagnose and to treat. Because so often, whether you're an athlete or just working a regular day job, even if you're just a stay-at-home parent, you're still in school, whatever it is that we're doing, when our shoulders get injured, it's incredibly difficult to realize what the problem actually is at the root, as well as the perfect solution in terms of rehabilitating towards your optimal goals. Many people find ways to compensate for lack of shoulder mobility by using their back more or using other equipment like ladders or stools or anything. We so often find ways to compensate for the range of motion that we don't have, and these very compensations make us even more at risk of injury and long-term problems. Because so many people wait to the last minute to receive proper care or to get the right intervention set up, often people resort to medications and sometimes even surgery, or they quit doing the things that they love, enjoy, and need to do altogether. We shouldn't wait until the last minute to begin taking care of our shoulders or taking care of any part of our body for that matter. According to Dr. Peter Attia, we are all leaning into medical intervention 3.0 because we need to stop waiting for a problem to be a problem before we start to do something about it. The best way to take care of your body and your health is to be proactive, and before even a problem occurs, working on all of your weaknesses and continue to progress your strengths so that you can live your best functional life. And that is absolutely what any physical therapist or kinesiologist, any treatment provider, even personal coaches, trainers, etc. If you're working on your personal development, these things should be crucial to you as you work to live out your best life and to make your body the best it can possibly be. As a physical therapist, rehabilitation usually focuses on strength, stability, range of motion, tissue extensibility, biomechanics. I personally think we should not wait until there's a problem to begin advocating for our health and working on our functionality. I'm not alone in this either. I'm sure most of you would rather work on improving yourself before there's actually a problem. You don't necessarily need to have a personal physical therapist if you don't have an injury or any problems, if you're here to prevent them from happening in the future. But even if you are, we're going to be working today in a range of motion that's comfortable for your needs and keeping our pain very low. If you do already have pain or any problems, those same principles apply. Please go slow. If something does cause you pain, you should stop doing that activity and find things that work for you currently before progressing to skills that you're not quite ready for. I will be providing a host of different mobility drills and activities over the next several weeks to improve range of motion, to improve the structural alignment of the shoulder. And once we increase the range of motion, we can then start working to advance our strength. Because as we increase the range of motion we have, we need to also focus on improving the strength within that increased range of motion as we develop it. As I'm doing these different exercises and activities, there will be some that fit your particular needs and there will be some that don't. You can skip over that exercise or replace it with one that you know has been serving you well and benefiting you. We can do things that are very, very low level. We can also work on getting some more advanced. If you have a problem, let's work on slowly improving ourselves. Make sure you're consulting a personalized medical doctor, a physician. You might even need your own physical therapist that's actually able to detail an assessment evaluation of you and make sure that the plan of care that's going to be established fits your unique and personalized needs. This video today, we are going to be really working on very basic skills and activities, range of motion, and increasing the mobility we have in the several movement patterns that are available at the shoulder joint. Whether we are working on flexion, extension, rotation, any combination of these movement patterns, you're going to be able to do some of them, but not necessarily all of them, and that's okay. Stop if anything causes you a tremendous amount of pain. Work in a range of motion that's comfortable for you, stopping where necessary, using very lightweight, body weight, no weight, wherever you need to be. If you're incredibly inflamed and in an acute stage of healing, you're going to want to resort to things like isometrics, being strictly compliant with whatever your doctor has encouraged you to do while you're dealing with acute and subacute stages of healing. There is a huge gamut of people that this can benefit, but be responsible, be your own advocate, and if movements are not appropriate for you, then I strongly encourage you to skip them. Thanks again so much, and let's get working.